Now, the most live local talk with Melody Burns.
Hey, it's 11:06 on a Tuesday morning. How are you? Strange weather. 1 minute it's sunny, next minute it's hail. It's rain, who knows, windy, but it's we're par for the course for the day. In the studio today with me, I have Dr. Lara Patrick. We are talking animals. So we're talking your dogs, your cats. We're going to let you ask her any questions you may want to about your dogs, your cats, or if you have any other strange animals, by all means. It's 476-1300. We're going to talk about pets for the next half hour and see what we can learn while we're here. So first, let's talk about an event that Shaker Veterinary Hospital is sponsoring, which is Bark for Life.
Well, good morning, Melanie, and thanks for having us here today. And yes, Shaker Veterinary Hospital is sponsoring the Bark for Life this year. That's going to be held on May 5th from 9 until noon, and that's going to be at the Cook Park in Colony. And Bark for Life is a wonderful event that's held in different places throughout the country. It's sponsored by the American Cancer Society, and it's a real nice get-together to raise awareness and also raise funds for the American Cancer Society, and to also celebrate the bond that our canine companions have with us and what wonderful caregivers they can be in our times of need, our times of hurt and sorrow, but also in our times of joy. And hopefully this event coming up will celebrate that, one of those wonderful times of joy that we can get out there and really enjoy, hopefully some nice spring weather with our canine friends and also our human friends, and support a wonderful cause.
I think it's a great idea. You know, it's true what they say about pets, that they can tell if something's wrong, and if something's wrong, they don't leave your side.
Oh, absolutely. And that is such the case. And unfortunately, last month, my father did succumb to cancer, and his little white dog, Possum, was by his side every moment of that time. She never left the bed. She never left the couch, wherever he was, infirmed at that time. She was right with him, and really was such a companion to him, and also now to my mother as well.
Oh, yeah. Possum, that's a great name for a little white dog.
She is the cutest. And she was a rescue. She came from Pepper Tree Rescue. They adopted her about 7 years ago. So she's been with them for a while.
Well, let's talk about that. We're talking about some spring hazards with dogs and cats and what we need to look at. And you guys have something new up there for preventative care. It's called the new Total Body Screen.
Oh, absolutely. And this is one of the gifts that we can give back to our canine friends after they give us so much of their love and companionship. And the complete body screen that we've now put together puts together a lot of the preventative care that someone would need to do on an annual basis for their dogs anyway. The heartworm screening that we all want to do every spring when the weather gets warm before we start our heartworm preventative and the mosquitoes come out. It also adds a fecal screening for intestinal parasites, a urinalysis to make sure that we're not missing any problems there, plus a complete blood count and a blood chemistry, which looks for any hidden problems that might be going on within the body, make sure all of the internal organs are functioning properly, and perhaps we can catch some things before they really become significant problems and fix them before our friends get sick.
So it's kind of like your physical. I mean, we do it as people. You do some blood work and you do all of that stuff. So you're pretty much doing that with the animals, too.
Oh, absolutely. And another part of that complete screen is looking for tick-borne diseases. Spring is here, and because we didn't really get a normal winter here in the Northeast, didn't get as cold as it usually does, I'm afraid that we're going to be seeing a bigger tick population this spring than we normally do. And that blood work screening includes that check for those tick-borne diseases that can be so detrimental to your friend's health.
Talking of that, before we come on the air, I talked to Dr. Patrick about my dogs. Most of you know I have 2 standard poodles, and we use Frontline Plus, and I don't give them a full dose, and I don't do it in the winter. I'm really strange about that stuff, but we've been finding ticks. They're not biting them, but they're like taking a ride. And you were telling me, well, that's because that doesn't have a tick repellent in it.
Right. Frontline Plus is a great product. It kills and prevents flea infestation. It also kills ticks, but it doesn't have a tick repellent. So a lot of people come into the office and say to me, hey, Doc, I'm still finding ticks.
Yeah.
They don't seem to attach too long. They don't seem to hang out too long, but why is this occurring? And it's because Frontline Plus does not have a tick repellent in it. There are some other products out there that you can use use that do have tick repellents. And certainly if you're finding ticks on your dog and need to change up, need some more information, talk to your dog or cat's healthcare provider, your veterinarian,
That's funny to hear.
about some alternatives that there may be out there. Canine Advantix is another product that's very helpful in deterring fleas and ticks as well.
Okay. Well, we open the phone lines. It's 476-1300. So let's do that. If you have a question for Dr. Lara Patrick about your pet, she is a healthcare provider for pets. I love that. Great term, right? By all means, give us a ring. Let's start with Donna in Schenectady. Hey, Donna.
Hey, how are you?
Good,
Your
how are
dogs
you?
Are adorable, by the way. I love the pictures. Keep them coming.
Thanks.
I was wondering if you ever heard of this. I have a 16-year-old cat. She was a feral cat. We coaxed her out of the woods, and she was pregnant, and she went and had babies, and I thought I knew where she had them, but the man wouldn't let me go in the garage. But I coaxed her back, and once I let her in the house, I took her right to the vet the next day and had her all checked out. She was fine. She's never been out of the house again, but about once a week for the last 16 years, she reenacts having kittens.
Really?
She has a toy. She brings it out. We call it her baby. She lays on the ground. She spreads out like she's going to be in labor. And she screams. And I go up and I go, "Oh, Maggie, that's a beautiful baby. That's a lovely baby." And I rub it on her, and then she gets up and walks away.
Well,
Now,
Donna.
do you have a memory of having kittens and still carry that?
Well, sure. Our animals know that they've given birth and know that they've had either litters of puppies or kittens or whatever the case may be. And sometimes they do go through hormonal changes and hormonal cycles that may make them feel those maternal instincts coming back out. So, I don't know if every day I see a case as extreme as the one that you're describing to us today, but we'll certainly have things of false pregnancies or animals that seem to mother a particular thing or seem to go through those stages.
It's really weird because people thought I was crazy, but they were sitting here one day and they saw it and they're going, "You're not lying." I go, "Why would I lie? It's the craziest. It's cute, really. Sometimes I don't want to get out of bed in the middle of the night to pet it, and I'll just yell from the room, 'Maggie, she's a beautiful baby. I love her,' and then she'll just stop. It's so funny. It's weird. I just wonder if anybody ever heard of that before."
Yeah, yep, that is something that we do see.
Okay.
All right, thanks, Donna. Hey, that's a different one, isn't it?
A little bit. Yeah.
I guess I never thought about that, but why not? All right. We did open the phone lines. It's 476-1300. I'm talking to Dr. Lara Patrick. She's with Shaker Veterinarian Hospital. We're talking about your animals and dogs, cats, and whatever. And if you have any questions, you can call and ask her. By all means, and she'll answer your question. But that was a different one. I've never heard of that before. I never thought about that. Was it because the cat was traumatized or something?
Oh, probably not. It probably has a lot more to do with hormones than the actual experience that the cat had kittens in the garage and maybe something bad happened there.
Oh,
probably
maybe
hormones.
We'll have to get her hormone replacement therapy or something. I don't know. All right, let's go back to the phones. We're going to talk to Tom in Saratoga.
Hello there, folks.
Hi, Tom. You got a question for Dr. Patrick?
Oh, yeah. We had an Irish setter, and this is a question now. Now we're approaching vacation season, and people may be putting their pets in boarding while they're out of town. And the question I had is, our Irish setter, we had boarded him, and we came home and picked him up, and he was kind of groggy when he came home because they gave him tranquilizers, I guess, to keep him quiet, and so he overdrank water, and his stomach turned over. I don't know whether this is something that happens with just big dogs or all size animals, but he had an excellent veterinarian. The veterinarian did surgery and corrected it, and even referred him out to Cornell University. We took him out to Cornell and had him checked out there, and he lived to be 14 years old. So, but it was really something that hit us out of the blue. We didn't know this type of thing happened.
Right.
And I didn't know how many people that are dog owners know about this. and how to monitor their pets so they don't wind up in that situation.
Right. Well, the situation or the condition that you're describing, Tom, is something that most people refer to as bloat. And that is when the stomach fills up with usually gas. It sounds like in this case it was water. And then for some reason the stomach actually twists on itself. So it pinches off the inflow and the outflow. So the stomach is this giant balloon of either food or gas or fluid. And it can't get out, which is an emergent situation for the dog. And it can actually die if there's not an intervention taken in a pretty quick course. And there's been a lot of theories out there, Tom, about why this happens and what causes it. And it's not in every dog that you're going to see this, but it's the big, deep-chested dogs that are a lot more prone to bloat than the other dogs, such as yours was an Irish Setter, Great Danes, Dobermans, German Shepherds, Weimaraners as well. All those dogs that have that really, really deep chest and then the skinny little waist. And that just gives the stomach extra room to move around in there. And some of the more current research has really shown that perhaps changes in stress levels are what causes bloat. People used to think that it was if the dog ate or drank and then ran around a lot, caused a lot of agitation in the abdomen, that would cause bloat. But now the theories are really going towards changes in stress levels. And when a dog goes through a stressful situation, and whether that's good stress, being really excited, going out on a long walk, having a lot of activity or something really fun to do, or a little bit more of the bad stress, perhaps boarding or an illness that the dog went through, change of food, that can really alter the chemical makeup inside the dog. The body responds to stress by producing certain types of hormones, which then can alter the bacteria that live inside the GI tract, the bacteria that's always living in your stomach. Those bacteria can suddenly have a change because of the hormone change that the dog is having. And with that change, more gas can be produced normally would be produced, and that can also attribute to the bloat situation. But that certainly is something that people, especially with those big, deep-chested dogs, need to be aware of. And as you have sort of described, that you didn't know that could happen, and thank goodness that you were astute enough and on the ball enough to get the dog right to the veterinary hospital when it needed to be, so that your dog could be saved and have that surgery.
We didn't know what was wrong with him. We got him up there, it must have been after 1 o'clock in the morning, and the doctor couldn't make us any guarantees. But
right.
Fortunately, he was very good at what he did, and he saved the dog's life, and he led pretty much a full life after that. That's
wonderful, Tom. And, I don't know what symptoms you experienced with your dog that night, but the most common symptom of bloat is a dog that's trying to vomit and just can't. So the dog retches and retches and retches and really isn't producing anything. And then people will also notice that the stomach is getting bigger and harder and in quite a bit of discomfort and pain.
Yeah, well, that's why we've got to maintain a good relationship with your veterinarian.
There you go. All right.
Absolutely.
Thanks, Tom. Okay, it's 11:20. Let me take a break, and then we'll come back. We'll continue to talk to Dr. Laura Patrick. I want to talk to her about dog breath and if there's a dental rinse or what we can do. I got an email on that. So let me take the break, and I'll be right back on Talk 1300.
You are listening to Talk 1300.
These are the days you've worked so hard for. Shouldn't you think about moving to a beautiful, friendly community for adults 55 and older? At Northway Estates, you'll meet great neighbors like Bill Dalaba.
This place it's great. It truly is great. It's a nice small community, very well maintained, friendly owners.
Take a tour of Northway Estates today.
The close community is the thing as far as we're concerned. If you want to get into an area where you're going to have people around and communication and be under the umbrella of good family-operated business, this is the place to move. I have friends that I wish they were a little bit older so that they could come in here.
Northway Estates, close to everything.
That's top shelf. We're very centrally located. Market's right here. Stores. We're right in between Clifton Park and Saratoga. We're exit 12, of course. So we can go 3 exits north or 3 exits south, and we can get to just about anything.
Discover Northway Estates. Call them at 899-2526. That's 899-2526. Or find them online at northwayestates.com.
This weekend, April 28th and 29th, the Greater Capital Association of Realtors will participate in the nationwide open house weekend. Are you in the market for a new home? Here's your chance to tour some of the area's finest homes across all price ranges. With sales continuing to improve, along with the record low interest rates, now is the perfect time to buy. The nationwide open house is this weekend, Saturday, April 28th and Sunday, April 29th. For a full listing of the open houses for this weekend's event, visit gcar.com. That's GCAR.com.
Are you afraid of the dentist? Do you know someone who needs to go to the dentist but is just too scared? Hi, I'm Dr. Harvey Winter of Albany Dental Care, and I want you to know about anxiety-free dentistry with sedation. If you hate needles and shots, if you hate the sounds, tastes, or smells you associate with a dentist, if you're embarrassed about your teeth, have a bad gag reflex, or always have a hard time getting numb, or if you just don't want to know anything that's going on during your appointment, then sedation dentistry is for you. I've treated hundreds of patients just like you and gave them the dentistry they needed while they were safely and comfortably sedated. So call me, Dr. Harvey Winter, at 482-0881. That's 482-0881. Or just go to albanydentalcare.com and online. And then you too can finally get that healthy and beautiful smile.
Call Dr. Winter right now at 482-0881. That's 482-0881. Or just go to albanydentalcare.com. That's albanydentalcare.com. Just ask for an appointment online, and then you too can finally get that healthy and beautiful smile.
All-Star Wine and Spirits in Latham Farms has the Capital Region's best wine and spirit selection. With over 20,000 square feet and some of the area's lowest prices, it's easy to see why at All-Star, you don't have to look like a warehouse to have warehouse prices. Stop by Latham Farms or visit us at allstarwine.com.
I'm Al Roney. Join me this afternoon at 2 right here on Talk 1300.
I entertain, I do it right. Thanks to Sam's Club.
Try us free and shop with no upcharge at the Spring Taste of Sam's Club open house.
I taste ahead of time, so I know it'll be a hit. And who doesn't love free samples?
Fresh meats, seafood, and more delicious items to prepare your spring.
To perfection.
Not a member? Join at the Spring Taste of Sam's Club April 27th through 29th, 11 a.m. to 6 p.m. Be one of the first 800 members to sign up for emails from Sam's Club and get a free cookbook. Sam's Club. Savings made simple.
As a nurse, I'm on my feet all day long. That's why I wear the ProFoot 2-ounce Miracle insoles. I used to wear gel insoles. Then I learned they're 3 times heavier than the 2-ounce Miracle insoles. The 2-ounce Miracle insoles are so lightweight and extremely comfortable. Plus, the gel insoles cost almost twice as much as the 2-ounce Miracle insoles. I'm not going to pay more for gel insoles anymore.
Try the ProFoot 2-ounce Miracle insoles with Vitafoam, available at Walgreens, Rite Aid, and other fine stores.
I'm Dennis Prager. Be sure to join me each afternoon starting at noon here on Talk 1300.
Okay, it's 11:24. In the studio is Dr. Lara Patrick from the Shaker Veterinarian Hospital up in Latham. It's on Maxwell Road. ShakerVet.com is their website. By all means, you should check it out just to get a little bit more information. Their phone number is 458-9669. And yes, they are sponsoring Bark for Life, which is on the 5th of May. The American Cancer Society, or you can type in Bark for Life, Albany, and you'll get more information about that. It's the relay. It is on the 5th of May. It's at Cook Park. I asked her a question. I asked Dr. Patrick about dog breath because I got an email from someone that asked me about it. What do you do about dog breath, and is there an oral rinse?
Well, dog breath is not normal. Your dog's breath should not smell bad, and neither should your cats. We'll put the kitties in here, too.
Yeah,
nobody's breath should really smell bad. And a foul odor coming from your dog or your cat's mouth is an indication that there's a problem in there. Most commonly, we see dental tartar buildup, gingivitis. I mean, just think about what would happen to my teeth or your teeth if you didn't brush your teeth ever and you didn't go to the dentist ever.
Okay.
It would be bad.
Sure.
It would be scary. People would not want to come near you. And that's what happens with our dogs and our cats, is that the tartar builds up on their teeth bacteria. The bacteria causes that foul odor. It also causes gingivitis, infection in the mouths. So dental care is just as important for our dogs and cats as it is for ourselves. And there is an awful lot of things that can be done to help correct this problem in dogs and cats. And really, oral hygiene problems or dental disease is the number one problem occurring in dogs and cats over the age of 3 years.
Oh, no kidding. I didn't know that.
It's very, very common. And it really helps to do things like brushing your dog or your cat's teeth, adding an antiseptic rinse to their water bowl. And also you can actually squirt these little antiseptic rinses into their mouths if they allow you to. And dental care is something that you should start to do when your dog or your cat is young or as soon as you get it if you're adopting an older one from the shelter. And very slowly introduce them to oral care. I usually tell people to go through a several-step process. One of them is just getting the dog used to you lifting its lip and rubbing your finger else in there, just your finger inside of its lip and on its teeth so that it gets accustomed to having its face handled. The next step that you can use is to take a little bit of dog or cat specific toothpaste, which usually are flavored in things like beef or chicken or vanilla mint, seafood, and use it as a treat. Get them used to the taste as well, and then try to get them used to you rubbing your finger with that product in its mouth, and then try to introduce that toothbrush before you do anything else. Don't introduce the toothbrush first, because that can be a bit scary for someone who's never seen a toothbrush.
Yeah, right. Whoa, what is this?
Yeah. So getting them used to the idea works much better than just diving in.
Yeah. Well, is there one particular brand of toothpaste they should use over another, or does it matter? How do you determine? I mean, do you go to the store and say, I'm looking for a dog toothbrush?
No, the brand that I like is CET, and that is a veterinary-specific type of toothpaste. And you don't want to use paste in a dog for two reasons. One, you don't want the fluoride in there. Nobody should swallow fluoride, and that's why you're always told to spit when you're brushing your teeth. We can't tell the dog and a cat to do that. So we want to make sure that we're using a product that does not have fluoride in it. And secondly, a lot of the flavorings that are put into human toothpaste can make a dog or a cat nauseous, just because it's kind of too much for them. Right. So they do make dog and cat specific toothbrushes and also toothpaste, which are very pet friendly and easy to use.
Wow. Okay, we have a minute and a half left. Do you want to give them more information about what you do, Dr. Patrick, and how they can reach you? And maybe what we should do as we move into the summer months?
Well, as we move into the summer months and hopefully some warmer weather, we really need to be thinking about preventative care. Flea and tick preventative, heartworm preventative, making sure that your dog's vaccinations are up to date, because more people will go camping, hiking, go to dog parks now that the nice weather will be here soon. And we want to make sure that these fun family events don't turn into a problem by picking up some sort of a parasite or picking up some sort of a disease that could easily be prevented. And I can always be reached at Shaker Veterinary Hospital, and the number there is 458-9669.
So it's worth coming in and just having the total body screen, I think.
Oh, sure. Start the summer off on the right foot. Make sure that you don't have problems currently brewing, and prevent any problems that may be happening throughout the summer months.
I think it's great. We did ask her, both John and I asked about the weirdest animal. You want to tell us what that was?
I think the weirdest animal that anybody ever brought in was Canadian lynx, and yes, they did have all of their permits. However, that little one was not very friendly.
You're right. Okay, that's cool. All right, I got to get the news in here at the bottom of the hour. We want to thank Dr. Lara Patrick for coming in. We'll have her back sometime so you can take more calls and answer questions. Let me get Mike in here with the news at the bottom of the hour. ShakerVet.com. Go to their website, check it out. I'll give them a ring at 458-9669. I'll be back in just a few minutes.
WGDJ Rensselaer is Talk 1300. Paul Vandenberg mornings, Fred Dicker at 10, and Al Roney afternoons. Stimulating local talk.